Hello, everyone. This is Abigail Spanberger, representative for Virginia's 7th District, and I'm so pleased that you all are able to join us tonight for our telephone town hall focused on coronavirus. We are lucky to have 4 distinguished guests with us: Dr. Christopher Newman, Chief Medical Officer and Operating Officer at Mary Washington Healthcare; Dr. Denise Bonds, District Health Director of Thomas Jefferson Health District for the Virginia Department of Health; Dr. Peter Kasson, Associate Professor of Molecular Physiology and of Biomedical Engineering at the University of Virginia; and Dr. William Petrie, Professor of Medicine in the Division of Infectious Diseases and International Health and the Vice Chair of the Department of Medicine at the University of Virginia. For the purposes of tonight's call, we will have a moderator, Dirk, handling the questions and going through the list. And I am going to turn it over to Dirk, but again, thank you so much for calling in. I hope that this is a productive evening and answers a lot of the questions that you all may have. So thank you for participating. And Dirk, I'm handing it over to you.
Thank you very much, Congresswoman. And a hearty good evening and welcome to the call, everyone. My name is Dirk. Thank you for joining our live, interactive telephone town hall. We're hosting tonight's event to give Congresswoman Spanberger and local health experts and officials the chance to speak directly with you wherever you are, in an effort to educate and inform as many people as possible and answer as many questions about the coronavirus outbreak as time permits. Now, this is an interactive forum, and we would love to hear questions from you about this developing global situation. We'll be taking as many questions as we possibly can live on this event. If you have a question, you can press *3 on your phone keypad at any time, and you will be placed in line to speak with a member of our staff. They will take down your name and where you're calling from. Then the next time you hear your name, you will be live on the call, and you will be able to ask your question directly. Now, there is a way you can listen to this call through streaming on the web at spanberger.house.gov/live. There, if you have a question, you can simply type your name and question below the streaming player. Additionally, if you would like to receive updates from our office via email, please press *6 on your phone keypad, and an operator will collect your email address. We could receive a lot of questions during this event, so if you're not able to address your question, please call our district office at 804-401-4110 during normal business hours. Again, if you have any questions throughout the event, please press *3 on your keypad or type them below the streaming player. If you'd like to receive updates from us via email, please press *6 on your phone keypad at any time, and an operator will collect your email address. Now, to kick off the call, it's time to hear from Congresswoman Spanberger. Congresswoman, the floor is yours again.
Thank you so much, Dirk. I appreciate it. I want to again thank everyone for joining us for this very important town hall to discuss the coronavirus COVID-19 pandemic. The goal of this event is to provide you all with helpful information, answer your questions, address concerns, and also discuss briefly what Congress has been doing to tackle this emerging public health challenge. I'd like to briefly mention some of what we've been doing on Capitol Hill and then turn it over to the health experts to discuss their knowledge of this outbreak. So last week here on Capitol Hill, we passed a large appropriations package that was focused on ensuring that we were taking action in a variety of different places. So first it was public health funding for prevention, preparedness, and response. So that's allocating and appropriating dollars to support our state and local health agencies that are responding on the ground through reimbursements. Providing low-interest loans to affected small businesses because we're already seeing the economic impact of this outbreak. Allocating hundreds of millions of dollars to ensure access to affordable vaccines and the development of those vaccines. $3 billion for research and development of other therapeutics and diagnostics as they may be necessary to contend with COVID-19 as it continues. and additional dollars for medical supplies, healthcare preparedness, and medical surge capacity. Of course, as I'm sure the physicians will mention later on the call, one of the challenges in contending with this is dealing with patients who are impacted by COVID-19, but also ensuring that hospitals can deal with tremendously increased capacity. So that's an appropriations bill that we passed last week in response to the first level of engagement, which is ensuring that we're working to create vaccines, that we are ensuring the development of tests so that we know who has this virus, and making sure that our hospital systems can manage it. What we've been working on this week, and ideally we will be voting very, very soon, is the next step, which was another appropriations bill for us to react to the impact on our communities. And the impact on the communities comes in, one, knowing who has this virus, so ensuring that we have access to testing. Our priority has been free testing. We want to make sure that anyone who might have this virus has the ability to get a test without a deductible, without a copay. It's healthy for them and it's healthy for the larger community. This appropriations package also establishes an emergency paid leave, an option of emergency paid leave, so that those who are sick with the virus can stay home from work, ensuring that they are not contaminating or spreading the disease, that they can follow guidelines and, in fact, self-quarantine. We are also working, this appropriations package should help protect our healthcare workers, to make sure that they have access to the protective equipment that they need. And we've been working within industry as well to make sure that there's an appropriate increase in the production of masks and other personal protective equipment necessary for our healthcare workers on the front lines. And also this appropriations bill would address issues of food assistance and security, as we're seeing across the country and certainly in the Commonwealth of Virginia. Many schools are closing, and millions of children rely on nutrition programs within our schools for their food assistance. And so we'll be making sure that there are additional resources available to those children. In Central Virginia, Feed More, the Central Virginia's food bank, is responsive and ready to deal with this challenge. And so for anyone who may have food security issues, feedmore.org has a button on its website that says Get Help, that can help direct anyone to a food pantry in the area if that's necessary. So what I just mentioned, those four pieces, that's we should be closing in on a deal and moving towards a vote on that within the House of Representatives today. All funding bills need to originate within the House, and then we will push that over to the Senate, ideally for quick action, so that we can start delivering free tests, food security, emergency paid leave, and protections for our healthcare workers as soon as possible. And we are already beginning conversations and have been in conversations about what else might be necessary in the future in terms of dealing with the economic impact to our larger economy and where Congress may play a role in that. But we are not yet finalizing any of those decisions. That's a brief overview of everything that's been happening on Capitol Hill. And with that, I will turn it back over to Dirk, and I await your questions. Thank you very much.
Thank you very much, Congresswoman Spanberger. And in just a moment, we will meet our panel of distinguished doctors who will be answering questions this evening. But I would like to take a moment and reiterate that this is a live telephone town hall. This is an opportunity for you to ask questions. If you do have a question, please press *3 on your telephone keypad at any time during the call, and a member of the representative staff will collect your questions. We'll answer as many as we can during this live event. And if you are participating online, you can submit your question below the streaming player window. Again, you can find this online at spanberger.house.gov/live. So now let's go ahead and meet our distinguished panel. First up, we have Dr. Christopher Newman, Chief Medical Officer and Operating Officer of University of Mary Washington Healthcare. Doctor, do you have an opening comment?
Yes. With Mary Washington Healthcare, we've instituted a pandemic preparedness team consisting of nurses, physicians, infection control specialists, and operational leaders that have been meeting regularly over the last several weeks as we've made plans for this pandemic. And currently we're having numerous daily huddles as we communicate and continue our preparedness. Dr. Mike McDermott, who is our president and CEO, and myself have also been having frequent meetings and conversations with other health officials and hospital administrators throughout the Commonwealth in conjunction with the Virginia Hospital and Healthcare Association and the Virginia Department of Health as we've worked on coordinating statewide response. Our main efforts have been really around social distancing. I think our most critical thing that we can undertake at this point is mitigating the spread of this disease and bending the curve and flattening the curve down. We've been heartened to see some of the private industry response in the last couple of days with cancellation of the NCAA tournament, ending the NBA season, and even Disney World closing. We've followed suit, canceling all of our events, meetings, support groups. We're conducting virtual meetings at this point. Our visitation policy, currently we're limiting our entrances to our facilities, and we are screening potential visitors for signs and symptoms of illness. But given the increased cases that have been reported in the Commonwealth, as of Monday morning, we are going to end visitation at our facilities at this point, with the exception of laboring mothers who will be able to have a laboring partner, or minor children, newborns, and our neonatal intensive care unit, where parents or guardians will be allowed to visit. This is critical because a lot of our patients are high risk. They're sick with other illnesses, and we need to protect them. We also need to protect our healthcare workers so that they are well and able to care for people as we face this coronavirus epidemic. We've inflicted a strict travel ban on all of our associates and medical staff at this point as well, so that we can help mitigate spread of the disease. We're conducting ongoing education of our staff, and we're having regular drills, particularly in our emergency departments, intensive care unit, other medical units, so that our staff are comfortable and prepared when patients start arriving with coronavirus. A lot of efforts have been around supply chain, with efforts towards preservation of personal protective equipment and other critical supplies that we will need to care for patients. A lot of concerns around not having adequate supplies at this point as we face this epidemic. And then lastly, a lot of work around capacity. We're actually in the midst of constructing a field hospital in the parking deck adjacent to our emergency department in Mary Washington Healthcare, which will allow us to take care of about 100 to 150 more patients in the emergency room a day, and allow us to separate those that are we're suspecting coronavirus from people who may have other medical conditions. We're also having contingencies around increasing our ICU capacity, ventilators, and other things, including eventually canceling elective procedures and things to create additional capacity. And with the anticipated closure of schools, this creates childcare issues. So we want to make sure that our frontline healthcare providers have the ability to come to work. So we are making plans for childcare for our frontline staff at present.
Thank you very much, Doctor. On the line also tonight, we have Dr. Denise Bonds, District Health Director for Thomas Jefferson Health District for the Virginia Department of Health. Dr. Bonds, your opening remarks.
Yes, thank you. So I'm just going to give a quick update on where we are with coronavirus and talk a little bit about what we are doing in my district, which is a neighboring district, and then more generally about what's happening across the state. So currently in the United States, there are over 1,600 confirmed or presumptive cases of coronavirus. That is, they've undergone testing. There have been 41 deaths. 46 states and the District of Columbia have reported confirmed or presumptive cases. Here in the state of Virginia, we've had 30 cases with 10 hospitalizations. We have not had any deaths to date yet. The governor has declared a state of emergency at this point in time, and that's opened up additional resources for those of us that work in public health so that we can respond to this current epidemic. Additionally, the governor and the state generally is working on promoting social distancing. Schools K through 12 are closed for the next 2 weeks to allow a deep clean and to really decompress and allow, again, that social distancing. We have testing available at the state, and there is commercial lab testing available both through LabCorp and through Quest. I will say that this continues, I think, to be an area of concern for the public because it is a bit of a bottleneck to get testing right now. There were some additional things talked about on the President's press release earlier today, and I'm hopeful that that will help relieve some of that bottleneck. So we ask that people be patient if they're seeking testing and certainly give either the Department of Health or their healthcare provider a call if they have the symptoms. As a reminder, the symptoms of COVID-19 are very similar to other respiratory illnesses, so fever, cough, shortness of breath. And I would also remind people that we still are in flu season right now, so just because you're experiencing those symptoms does not mean that you have COVID-19. You may have the flu, and you should certainly talk to your healthcare provider and think about getting testing for the flu. Our objectives right now are to protect vulnerable populations, and we consider vulnerable those that are older, for example, people over the age of 60, and those that have chronic medical conditions. And we use the same medical conditions that we would use for those that we consider at high risk for influenza. We want to protect our healthcare industry and our healthcare organizations because if we see too many cases at once, that's going to really flood our emergency rooms and our ICUs, and we're going to run out of everything. We're going to run out of healthcare providers and masks and ventilators, and we don't want that to happen. So what we really need to do is what is called flattening the curve. That is slowing down the rate that we have cases so that we stay within our surge capacity for our health care. And then finally, we have not forgotten that there is a huge economic impact to this disease, and we certainly want to work to minimize the impact, the economic impact in our communities. So locally at the health department, we're working with all of our government agencies. We're working with all of our first responders and our law enforcement to make sure that everyone has the correct information. We are beginning to local governments are beginning to limit large public events so that, again, we can practice that social distancing. Locally, we're doing contact tracing of cases so that we can get testing done of those that are especially high risk. And then we encourage people who believe that they may have come in contact with someone to really consider that 14-day social isolation where you stay in your home, stay away from other people so that we try and break that spread. So those are the things that are happening right now. I think we have made a great start to trying to slow this epidemic down.
Thank you very much, Dr. Bonds. Next on the call with us, Dr. Peter Kasson, Associate Professor of Molecular Physiology and Biomedical Engineering at the University of Virginia. Go ahead, Doctor, if you have opening comments.
Yes, thank you. As my two colleagues earlier have described, the public health interventions are really the immediate tools that we have to start slowing the progression of the coronavirus infection. What we do is more advanced research, try to put a greater variety of tools and better tools in the hands of the public health and medical community over a slightly longer period of time, because we believe it's likely that this virus will be with us for a while. We work on the mechanics of how emergent viruses, such as the coronavirus, infect cells, and how the immune system, especially antibodies made by the immune system, can interfere with this. And so what we've been doing has been repurposing a number of tools and expertise that we've developed for influenza to the coronavirus to be able to study how antibodies stop the coronavirus as both vaccine trials start to come through and to assess immunity following infection, and to use this information to be able to design better vaccines. And so we're working together with my colleague and the next speaker, Bill Petrie, to try to do research and develop second-generation vaccines that will provide improved immunity against the coronavirus. There are already vaccines moving as quickly as possible towards clinical trials from the National Institutes of Health and others. Delivering safe vaccines is a slower process than everyone would like, but part of that is because the safety parameters on vaccines are extremely stringent, and we care a lot about that. But we're moving as fast as we can to try to assess how immunity works against this virus and to use that knowledge to develop the best vaccines possible to protect the state's residents.
Thank you very much, Doctor. And our final distinguished guest this evening on the call, Dr. William Petrie, Professor of Medicine in the Division of Infectious Diseases and International Health and Vice Chair of the Department of Medicine at the University of Virginia. Doctor, your opening comments, please.
Oh, thanks, Dirk. I want to first thank Congresswoman Spanberger for her support for new appropriations to deal with this pandemic. And with Peter, the two of us are working on a vaccine, and we're actually applying to the NIH for support to move that work forward. So thank you very much for that. I think Chris has done a great job of summarizing how Mary Washington Hospital and in a similar way the University of Virginia Hospital are preparing for this epidemic. I can add that we're also limiting travel of all of our healthcare providers so that they're available and that they're not at risk of acquiring the infection through travel. We're making additional capacity available, just as Chris was mentioning. In our case, we have like a new wing of the hospital that's not quite ready to open, and we've been able to make 30 additional beds available sort of ahead of schedule. We have a backup schedule for all of our clinicians because we sort of suspect that, as people have infections, they're in quarantine for 14 days where we need to have like backup, and that's all set up. And through the leadership of Foresee and Carlene Muto, we've set up a COVID-19 clinic that is going 8 a.m. to 8 p.m. 7 days a week to care for people, to help with if you're considering the diagnosis. And the last thing I'd say that's happening locally, just before this call started, Melissa Kendall, who is one of our basic scientists, just donated her PCR machine to clinical microbiology so the UVA can be up and running the CDC test for COVID-19, which requires a very specialized PCR machine, which our clinical micro lab did not have. And then I would just echo what Denise was saying as well, is that the hand washing, not touching your face with your hands, the social distancing is all terribly important, even for young people who are probably not at great risk of having severe COVID-19. We need to all be in this together because we're trying, just as Denise was saying, we're trying to keep the rate of increase at a manageable level so that our hospitals in the U.S. are not overwhelmed, such as the situation I think we've all seen in northern Italy. So Dirk, thank you.
Thank you very much, Doctor. So we will be getting to live questions in just a moment. If you do have a question for anyone on tonight's call, please press *3 on your keypad now to enter our phone queue to ask that question. Again, this is an interactive telephone town hall where you can ask questions of the experts. All you need to do is press *3 on your telephone keypad. We're going to take our first question. We've got Joanne on the line. And Joanne, you're concerned about patient surge. Go ahead with your question for Dr. Petrie.
Yes. I was wondering what steps have been taken to prepare for the surge, not only with equipment but with staffing too, ventilators, masks, gowns, isolation rooms, any of the things that these patients would need. What has been done?
Oh, thanks. And that's a great question. And I think Chris is also can probably address that as well. And so, again, through the leadership of Foresee, and Carlene Muto, we have a whole part of the intensive care unit which has respiratory isolation capabilities. This was actually originally set up because of the Ebola risk a few years ago. There's protective equipment. One good piece of news is that the CDC has just come out with new recommendations that the patients don't necessarily have to be in negative pressure rooms, which is huge because those are the most limited resources. Again, we're making sure that we have adequate backup so that if staff themselves has to go into quarantine, and then having additional rooms in this new wing of the UVA hospital. But again, I think as Denise was saying, it's we can all do something through social distancing, through hand washing, to limit the rate of increase so that we're not overwhelmed with our healthcare facilities.
Thank you very much, Doctor. Anyone else like to chime in?
Yeah, this is Dr. Newman with Mary Washington Healthcare. I can see we've obtained additional ventilators that we had for this kind of situation. So we have up to 70 ventilators in our health system between Stafford Hospital and Mary Washington Hospital. Of course, it's more than the ICU rooms that we have, so we have contingency planning to use sort of our PACU or like recovery room areas, some of our same-day surgery operating rooms where we can do critical level care. And then for isolation protocols, we have certain units where we're going to cohort patients so that we don't have patients spread throughout the hospital, mixed amongst patients who may have other significant illnesses. I spoke earlier about the child care, so as schools close, in order to extend our staff and protect our staff, we are making, contingency planning to take care of their children, so our frontline staff can actually care for patients. And then we're constructing the field hospital, a temporary field hospital outside of our ED to expand our emergency room capacities at this point, and then prevent the mixing of potential COVID patients with those who have other serious medical issues coming for care.
Thank you very much, Dr. Newman. Moving forward to a question from the internet, Paul wonders, do symptoms need to be present for the virus to be transmitted? And we'll give that to Dr. Kasson. Dr. Kasson?
Apologies. The answer is as best we know they don't. That the virus can spread slightly before symptoms are present, which is why it's particularly difficult to contain this, and it's particularly important for all of us to try to reduce large group gatherings, as the Department of Health has suggested, and when we think we might have been exposed, to try to reduce our contact with others. But there have been several studies out of Germany most recently where the virus was detected in patients before symptoms were present.
Thank you very much. Anyone else on the panel like to add anything about the transmission with symptoms not being present? Okay, then we will move forward. Moving on now, we've got Stuart. And Stuart, you're looking to find out about the attention given this over the flu. What is your question? Hello, Stuart. Well, I think it's actually a pretty good question, even though we've lost Stuart. So the question is, why is there so much attention to this when the flu kills so many more people? Dr. Newman, would you like to respond?
Yeah, this is a distinctly different pathogen than the flu. It's difficult, but looking at the World Health Organization data, epidemiological data that we've seen so far, the mortality rate is anywhere from 1 to 5% that we're seeing. That's 10 to 50 times the standard flu. And some other differences, although 80% of people have mild self-limited flu-like symptoms, up to 20% of people are getting serious illness, and including 6% of folks that we've seen that are requiring ICU level care and ventilator support. and those illnesses are lasting 3 to 6 weeks. So 6% of a large amount of people getting sick requiring ICU support could very quickly overcome our healthcare capacity to care for people. I also think, in my 18 years of hospital medicine taking care of patients with the flu, with the exception of certain strains, generally kills those with very elderly, a lot of other comorbidities. We are seeing risk factors of just being in your 60s or 70s being risk for mortality and serious illness. And this could cause a lot more disease. And I think as we look to what's happening in Italy, that's what gives me some very significant concern, why this is a much more serious situation than your standard annual flu.
That makes an awful lot of sense, Doctor. Anyone else care to chime in?
If I could step in, this is Peter Kasson. We actually do a lot of work also on the flu, and I think the appropriate comparison wouldn't be to your annual flu, but pandemic flu. That this is a new virus that essentially no one in the world has immunity to. And so if you were to think about 1918 flu, that was a serious pandemic that affected a lot of people and killed a lot of people. And the new coronavirus is a different disease. It's not the same as that. But I think that's a more appropriate analogy for the type of situation that we're in than the annual flu. But it's another pandemic disease.
Thank you very much for that insight, Doctor. Next up, we've got Irene, and Irene's got a question I think will be best for Dr. Bonds. Irene, you're looking to talk about testing? Go ahead. You're live.
Yes, I was interested in what exactly is the test that is done when they talk about going in and having a test.
Sure, that's a great question. So when people go in and get a COVID-19 test, a coronavirus test, they're going to get swabs of what we call the nasopharyngeal. So they're going to have either a swab put up their nose or a swab at the back of their throat, the pharynx area. We also like to get sputum. So if someone has a lot of sputum and they're coughing, we might try and collect that as well. And then that's all sent off either to a commercial lab or to our state lab, depending on the circumstances for testing.
Thank you very much, Dr. Bonds. Now we'll go back to another web question that just came in. And this question for Dr. Kasson, you've got someone, Jane, she's healthy and active. She doesn't believe she's been exposed to COVID-19. Should she stop going to her group exercise classes? Doctor?
It depends on the size of the group. That essentially every group contact epidemiologically is another statistical risk for transmission. And this is a difficult question and something that I believe my public health colleagues struggle with a lot is what's the appropriate degree? Where do you set the cutoff? But even if people are perfectly healthy, the worry that any individual may acquire this and may transmit it even before they're aware that they have it. We all have friends and relatives who are not healthy, who are older, who are at risk, and we want to keep those people safe. And so what the size of the group is that becomes too big is a difficult question that I defer to my colleagues. But I think the idea that we all want to try to interact in smaller groups and have fewer of those interactions to keep all our friends and loved ones safe is the overwhelming principle.
That makes an awful lot of sense. Anyone else care to add to this?
Yeah, this is Denise Bonds from the Health Department. I would say, a great thing to do is to look for alternatives to your group exercise class. So taking a walk outside is a great way to get some exercise, to socially distance yourself, even if you do it with friends. Just remember to keep that 3 to 6 feet apart, and to still get that exercise that's so important for our health. And then I would also say that if you're going to an exercise class or you're going to the gym that has a lot of equipment, we often will clean the equipment after we use it as a courtesy to the next person. But in this situation, I would really recommend that people clean the equipment with the cleaners that are available there before they actually get on and touch the equipment, because then you know that it's clean. Then you know for sure that someone didn't walk away inadvertently and not clean it.
Very good point, Dr. Bonds. And we're going to another caller, and this caller has a question that I think you're very well adept at answering. So, Sherry, go ahead with your question for Dr. Bonds.
Hello, Dr. Bonds. My question is this: is there going to be one online resource where the general public can go to know what steps to take if they feel that they need to be tested or they're not sure about their symptoms, how they can obtain medication, all these types of things, and what kind of preventative care other than the general hand washing and sanitizer, what they can do to build up their immunity so that they don't fall for a bunch of scams out there? Because right now a lot of people are jumping on that bandwagon. So I was wondering if there's one local resource that you'll have available online where people can go to.
So that's a great question, because the best way to avoid panicking is to have knowledge. Knowledge is really powerful. And so I recommend to individuals that they go to 2 sources, and you'll find that a lot of the information is the same on both of them. And the first is the CDC. The CDC, if you just go to www.cdc.gov and click on their coronavirus, they have information there for pretty much anyone's circumstance. And they have a great 10-page document right at the top that says how to mitigate in the community, or community mitigation. And in there is a whole series of tables that says the steps that you can do depending on which group you belong to. So it has groups for the individuals and families, for schools, for faith-based organizations, all sorts of different groups. And you'll see them in 3 different columns. The first is preparedness. The second is if you have mild to moderate spread in your community. And the last is if you've got it widespread. And there are different actions that you can take in all of them. In the Rappahannock, because you have had a reported case, I would consider you in that middle column, that mild to moderate. So it's important to look at all the preparedness things to make sure you've done that. But then you should also look at those in that middle column to see if there are additional things. If the CDC website is not available, or you don't find the information that you want there, you can also go to the Virginia Department of Health website, and that's www.vdh.gov, and click on the coronavirus. And you'll see there's lots of tabs there that you can click. And again, it's laid out by what group you belong to. So lots of information there that you can read to really become an educated individual and to avoid some of those things that you talked about.
Thank you very much, Doctor. Next, we've got Peggy, who's got a question I think best for Dr. Newman to begin with. Peggy, you're looking about symptoms. Go ahead with your question, please.
Yes, I am a widow, and I live alone, and we have many in our neighborhood. And I'm wondering how sick I would have to get if I thought it was the virus, or what symptoms I might have, and would I call the ambulance, and would they take me to the hospital, or just what is the procedure I need to follow?
Yeah, so the symptoms that we're concerned about is if, you would have high fever, significant shortness of breath, weakness. Those are the kind of things that we would encourage you to come seek treatment through the emergency room, and perhaps if you're not feeling poorly enough, to call an ambulance to assist you. Most people do have very mild symptoms, fevers and aches, some of those kind of things when we cough, and we recommend people at this point to stay home because we don't have a ready supply of ability to test at present. That will hopefully change in the near future. Other risk factors that I get concerned about, and we encourage people to seek care, is advancing age. If you've had cancer, immunocompromised, heart disease, significant lung disease, those are the risk factors where you can get sick, and we want to be caring for you.
Thank you very much, Doctor. Moving on to another question now. We've got Joan on the line with a question. I think Dr. Kasson, you're probably best suited to answer this. Joan, go ahead with your question, please.
Yes, I was wondering if there are any plans, maybe in the future, very near future, to be able to go to like a 55 and up apartment complex where you know that there's going to be risk factors, and is there any plans to go there and test where you could test like a group in an apartment building rather than them coming out to be tested?
To my knowledge, yes. I think that's obviously a good idea. To my knowledge, right now, we are in the process of expanding our testing infrastructure. And so until we're able to test as many people as we'd like, we're testing people who are not at high risk, but we don't have a suspicion yet, but testing people where we have more suspicion that they may be infected. As the testing infrastructure increases and the number of tests we can run becomes not a limiting concern, then I think what you're describing would be a very good thing. To my knowledge, there are not current plans for that. Again, my colleagues at the Department of Health can correct me, but that would be something as we move forward in this pandemic.
Thank you, Doctor. Dr. Bonds, do you have anything to add to that?
So testing certainly continues to be a bottleneck. That is absolutely the case. It's great that we now have some commercial labs, but they're really trying to supply these test kits all over the United States, and that's a big area. We are working to make sure that those people that are at the highest risk or have pretty severe symptoms that we can't otherwise figure out a cause for have access to those tests. We anticipate that testing will be more widely available very soon, and when that is, I think you'll see more streamlined testing procedures, such as testing in your car or clinics devoted to testing. But right now, we just don't have the availability of the actual test kits to do that. So they're working hard. We're trying to get them out there. We're making sure that the people who are really having the most serious symptoms and we can't otherwise figure it out have access to that. But it continues to still be a bottleneck right now.
Dr. Bonds, thank you very much for that answer. Next up is talking about potential vacations. And Dr. Petrie, you might be able to answer this. Jackie, go ahead with your question, please.
Hi, our family was planning a trip to Arizona on spring break, and we are trying to decide whether we should cancel the trip or go on the trip. That's it.
Dr. Petrie, any thoughts? Anyone on the panel wish to talk about the notion of taking a trip, whether it be for spring break or even later into the summer?
Okay. So, these are the hard decisions that people have to make right now. And I think I would think about a couple of things as making that decision. So first of all, if you or one of your family members got exposed to somebody, either while you're flying or while you're in Arizona, can you afford to be in your house for 2 weeks isolating because you were a contact to a known COVID case? So that's one thing. And then the other I would think about is, who are the family members that are going with you? Do any of them meet that high-risk criteria? Are you bringing grandparents along who might be over the age of 60? Do you or any of your family members have one of those immune-compromising conditions or have lung disease where it might be really serious if you got that? Those are all the things that I would really take into account. Everyone's going to make their own risk-based decisions. But my understanding is that generally airlines and hotels are working hard to provide refunds for individuals who do choose to alter their travel plans. And, you know, the Grand Canyon and Arizona and Sedona and all those lovely places will still be there.
Very true point. Thank you very much. Next, we have Yvette. And Yvette, you want to talk about vaccines. So Dr. Kasson, please listen to this question and be ready. Go ahead, Yvette.
Hi, yes. I'm wondering, when do you foresee the release of a vaccine? Also, I was reading an article and I have some concerns about it being fast-tracked and skipping animal testing and going straight to humans.
Yes, so I can speak to the first, for starters, that I think the first vaccines that are moving as quickly into human trials as possible, and I'll talk about that later. If everything goes well, I think the anticipated timescale is about a year. That would be, that's obviously slower than everyone wants, but for a new vaccine is incredibly fast, both because it has to be tested for safety, it has to be tested and shown to be effective, and then it has to be produced at large scale because we want to use this for a lot of people. In terms of bypassing animal trials, the vaccines that I'm most familiar with, which are the ones that the National Institutes of Health are coordinating, are based closely on vaccines that were developed for other related coronaviruses, SARS, and there was also some work done on MERS, which is one that's been present in the Middle East more recently. And so there were animal studies and non-human primate studies done on those vaccines. And so one of the reasons why there's some confidence in advancing these more quickly is that they're very closely related to vaccines that were tested at that stage. Obviously, vaccines that are a little newer, the ones we're working on, go through many more stages of testing because we don't put something into people that we are not quite confident will be safe.
Thank you very much for that answer, Doctor. Anyone else on the panel care to add to it? Okay, if not, moving on to another web question, and this question comes from Paul. Who's most at risk? Young, old, infants? Dr. Petrie, do you have an answer, sir?
Yes, so the average age of a patient with severe COVID-19 is mid-50s, early 60s, and so, so half the patients with severe disease are older than 60, half are younger. It's unusual to see severe infection in children. Children, however, can excrete the virus for a longer period of time, and so could be significant as far as spreading the infection to the elderly who could have more severe disease.
Very succinct. Thank you. So we're going to go back to another caller. This time we've got Eileen on the line. Eileen, you've got a question I think Dr. Newman will be best to answer. It's about information. So go ahead with your question, Eileen.
Yes. My question is this. Earlier in the call, one or two of the doctors referred a caller, and at the same time all of us, to the CDC website and the VDH website, and there may have been another one, in order to get updated information. And my question is based on is a question about those referrals. Do you all feel confident that we go to those sites? Well, in particular, the federal site, the CDC site in particular. If we go to that site, do you feel comfortable, confident we are actually being given unfiltered, factual information that is not having to go through another source to be approved? Are we getting it straight from the health experts and not through non-medical approval? I hope I'm clear enough.
Yeah, no, I can speak to that. You know, the CDC is the best information that we have. This is a new situation, but I think that is the universal best information that we have. Mary Washington Healthcare is working closely with the Department of Health, and then we are frequently getting our information from the CDC, which in this pandemic is rapidly changing. Recommendations are changing as this goes, but I believe it is the best information that we have as we face this pandemic.
This is Bill Petrie. I just add to what Chris is saying. I just went through the CDC webpage too, and I found the information there to be accurate and reliable. And the nice thing is there's multiple sources of information. So, as Denise was saying, there's also the World Health Organization, the Virginia Department of Health, and so you can go between these different sources of information. And for the large part, it jives. And of course, there's a lot of scientific publications that have been peer-reviewed now that are also out. And so, I would share your concern, but I think that in this case we're getting accurate information.
Thank you very much, Doctor. We're going to move on now to Brenda. And Brenda's got a question about medical resources. And I think, Dr. Bonds, you'll be a good person to answer this. Brenda, go ahead with your question.
Hey, good evening. I'm a school nurse, and I'm out for 2 weeks. But I serve a rural demographic, and one of the biggest challenges I have with my 276 students is getting them access to medical care. We have limited resources when it comes to public transportation, limited clinics, limited availability to an urgent care facility or ER. Most of my patients would have to travel 45 minutes to an hour to get to those locations. So my question has to be, are there any plans in place to get to these populations to provide care?
So that's a great question, and certainly access in our rural areas is a real challenge for people. And part of my district is very rural and has very limited numbers of providers. And people like you who work with populations of kids and populations who are elderly really struggle to get them to care. So some of the things that are being looked into would be a telemedicine type situation, trying to get our local paramedics educated so that they can help provide and answer questions in the area, because often they're closer and have more availability to assist. And then I think having people remember that, if your symptoms are mild, calling somebody and talking over the phone about what you should do is a reasonable first step before you try and make that 45-minute drive in. You want to make sure that if you're going to make the drive in, that where you go to is set up to do testing if testing is needed, that you don't need to go directly to an emergency room because your symptoms are so severe. So it's a challenge. I think there are some strategies that we can begin to explore, but we certainly recognize there is difficulty.
Thank you very much, Dr. Bonds. Moving forward, we've got Henry with a question about scheduling of surgery. Henry, you're live, and Dr. Petrie, listen closely, please.
Yes, greeting to everyone, and thank you so much, Representative, for this forum and all the many blessed professionals there. I have delayed colonoscopies because of cancer, chemo, and radiation I went through last year. I have it now scheduled within the next 10 days. Don't want to take up capacity and less concerned about myself. What might someone advise?
Oh, Henry, that's really wonderful to hear. That you're sort of putting everyone else in front of your own health care. We are at the University of Virginia trying to limit elective procedures. I think, just as Chris was saying, at Mary Washington as well, to increase capacity. And so I think that if it's not detrimental to your health to delay the follow-up colonoscopy, I think that definitely would help, because that'll increase our capacity.
Thank you very much for that answer, Doctor. And moving on, this one for Dr. Kasson. Cadret, I believe, in your question about the virus. Go ahead, you're live with the doctor.
Hi, yeah. So once, say, you contract the virus, is there a chance that you can contract it again? Say somebody in your family then gets it after you've recovered. What is the chance of that?
So since this is new, we're still figuring this out. The best evidence we have is that once you contract it, we don't think you'll contract it again, certainly over a period of a few months. But this is very much something we're still learning, because this is a new virus. But there's no evidence right now that you'd get it and then get it back from one of your family members. People around the world are watching this intensely, and we're following the world medical community and the emerging evidence on this. Whether the immunity to the virus lasts year to year is something that we'll find out with time, but we think it will certainly last week to week and probably month to month.
Thank you very much for that, Doctor. Next, we go to another question from online, and this one comes from Kat. And probably, Congresswoman Spanberger, you're best to answer this. Looking for an update on the Speaker Mnuchin Senate status.
Thank you. Well, I was delighted to hear so many of the questions that we've heard from constituents across Virginia, and I'm so grateful that we have such strong panelists on tonight to answer the medical questions to everyone engaging. Thank you so much. So an update on where we are. We have gotten confirmation that indeed we are moving forward with a deal. That would be House leadership has been working very closely. You know, in this case, our goal is to move quickly. We are in an emergency circumstance, so the goal is to move quickly. So while all appropriations bills do, constitutionally speaking, originate in the House of Representatives, it has been important to us to ensure that we are on the same page with the Senate and with members of the administration. We certainly do not have time to go back and forth with debate and conference, as it's called, when the House and the Senate agree on different things and then need to come to resolution. So I have officially gotten notification, in fact, that we have reached a deal. It was in the works. We were almost there last night, and today we've come to the final conclusion. And the bill that we will be voting on tonight, it is a bill that is addressing some of the topics that I mentioned at the top of the phone conference, the teletown hall. It's focused on delivering immediately for the community. So specifically, it's ensuring that the tests are free. That is incredibly important. Of course, that doesn't negate some of the challenges that some of the doctors have spoken about related to bottlenecks and how to go about getting the test. But first and foremost, no one should feel that the cost of a test is an impediment or causes them to not pursue medical attention. So the tests will be free. We're looking at the economic security of families and individuals impacted. So we've reached a deal to have emergency paid leave. So that's 2 weeks of paid sick leave for the circumstance of emergency COVID-19. and that will be for anyone who needs to take time off in order to protect themselves and, frankly, the larger community. As the physicians talked about, we need to make sure that we're employing social distancing and that anyone who is ill is able to quarantine. And one of the primary ways that we can give assurances to the community that they can quarantine is knowing that for those who might not otherwise have sick leave at their place of employment, that it will be extended in this emergency circumstance. We're also addressing food security issues, so we're looking at strengthening security initiatives, including SNAP. So many of our nation's children will not be in school these coming weeks, and so it's important that we're able to get additional resources to them and their families so that they can make up for the loss of those meals at school. We're also paying particular attention to our seniors. Of course, so many of America's seniors do rely on programs like Meals on Wheels, and we want to make sure that the funding is there. And then in addition to that, we're increasing federal funds to Medicaid to support our local, state, and tribal territorial governments and those systems. And so I would also mention at this time, Virginia had Medicaid expansion, which has been a tremendous resource for Virginians across the Commonwealth, and the federal government will be assisting the Commonwealth of Virginia and the other states with additional financial resources as they endeavor to help the public. So this is the second of 2 emergency response packages. We are going to be beginning the work on a third package that will again be addressing the health and economic security of the American people. We expect that to be looking at basically as the coming days and weeks come, what challenges we see our communities facing. We'll be addressing that with our next large package. And my expectation is we will be voting on that at some point this evening, though we haven't gotten final word at what time votes might be called.
Okay, thank you very much, Congresswoman. And I'm just being told we need to kind of wrap this call up. Do you have any final thoughts or comments?
Well, I want to thank everyone for participating in this call. To the people of Central Virginia, thank you for joining. Thank you for spending time with us. I hope that these questions that you've heard from our neighbors have been helpful, that the answers have been informative. This live town hall we have recorded it. We'll have it available on our website and out on social media. So if there's any questions that you want to go back and revisit and listen to the answers given by medical professionals, if you want to share it with others, we welcome you to do that. And I'm really just so appreciative that we have medical professionals who have spent their time with us helping educate the people of Central Virginia. And I am grateful for everyone's participation. And also, I would mention, as I did at the start of the hour, those who might be facing food security issues, you can go to feedmore.org, and there's a link there that says Get Help. You can look where there might be local food banks and resources within the community close to your home. And then, as it was noted multiple times on the call as well, for sources of additional information, you can go to cdc.gov. They have a special page for the coronavirus, Virginia Department of Health, so that's vdh.gov. They also have a special page for the coronavirus. And we will continue to send out alerts and information on social media, on Twitter, on Facebook. And on our website, we have a special link that is also at the top, coronavirus, if you go to spanberger.house.gov. Thank you so much for your participation tonight. If you have facing any challenges, any particular needs, or need to be in touch with our office, you are most welcome to call us. Our constituent service team can be of help. Notably, we have had constituents who are facing challenges related to coronavirus, and they have reached out to our office to get assistance. So we welcome you to do the same if you need to.
So for everyone on the phone with us and those listening online, thank you for taking the time to join us for this important telephone town hall with Congresswoman Spanberger and our local experts. We appreciate the opportunity to answer your questions, but if we were not able to get to your question this evening, you can call our district office at 804-401-4110 during normal business hours, or you can go online to spanberger.house.gov. We will host more of these events in the future to keep you informed on what Congresswoman Spanberger is working on for the residents of Central Virginia, available resources in the 7th District, and other important updates. Thank you again for your participation in tonight's call. Stay healthy, stay safe, and have a good evening.